Hey YouTube! For those who don't know me, my name is Gary and I'm a registered respiratory therapist. I recently just passed my boards, both my TMC and my ClinSims, and one of the things that is really frustrating as a student who's preparing to take the boards is that there's not a lot of study material, there's not a lot of things to reference off of on what you should do exactly. So I'm going to share with you what worked for me. Just a disclaimer, what works for me isn't gonna work for everybody, but this is what I did and I passed, so let's get to it. So I'm not exactly sure how your program works, but how mine worked is that we took the Kettering seminar. And that was not required, but it was obviously highly recommended, and that is what I did. So when you take the Kettering seminar, you get 4 books. 2 of them are dedicated to the ClinSims, and 2 of them are dedicated towards the TMC. What I did though was I did use one of the books that's for the TMC, which just has so much information. Like, it's such a good study guide, and there's a lot of good things written in here. And it's just easy to read and understand. In this book, in the back, they have a pathology section, and it says, like, for example, pneumothorax definition tells you what it is. Patient assessment tells you what you're going to see. Diagnostic testing tells you what tests you need to do, and then treatment and management, it tells you how to manage a pneumothorax. So that is really handy to just go back to and reference, and to just constantly refresh your memory of what certain diseases are and how to fix them and whatnot. Okay, so what I did with the lecture notes with the Kettering book for the ClinSims is it just has every disease and basically exactly what the TMC study guide is, but it's just all about the diseases, and it tells you like what meds go for what. And I went through this book a good time once, an okay time twice, and then I would go back to separate pieces of the book to review. And what I did with that was I took my own notes. So for example, I would go to COPD in the book, and then I would write down what I'm going to see with that patient, and that is your information gathering. So when you take the ClinSims, there are 2 sections. There's your information gathering and your decision making. Your information gathering is worth more points. So it's really important to do well in the information gathering, because the decision making can be really hard sometimes, or tricky. And it's going to say like physician disagrees, and that's going to happen a lot sometimes, and it's going to give you negative points. So you really want to have all those extra points with your information gathering to kind of save you. So what I was saying, going back to COPD, I would write down what you're going to be seeing with the patient, and then I would write down all the tests that you would do, and then I would write down the decision-making choices. So for example, with COPD, you're going to see someone who's dyspneic with a barrel chest, digital clubbing, you're going to hear diminished breath sounds and wheezing. And then for decision making, you're going to look at your tests. So you want to do an ABG, and you might want to do a sputum culture and chest x-ray, PFT. And then for your treatments and your decision making, you definitely want to start at a low FiO2, and then or a Venturi mask or fixed FiO2. And then when you did your sputum culture from before, it's going to give you the results of what that's going to be, and maybe you have to give antibiotics, or they have a decreased PFT values, you know, and so you kind of go from there. And then of course you want to give your bronchodilators and maybe an anticholinergic or a steroid, and then teach them about like smoking cessation and whatnot. So that's like what I did with my notes, is I would basically just write down everything about that disease, but put it in my own words. When I write down, that really helps me to retain information, so that might help you as well. And okay, moving on. So Kettering also gives you a simulation problem practice book, and there's not that many simulations in here, but there's at least, let me see, there's at least 9. So in class, we actually did a good chunk of this, so by the time I studied and everything and wanted to practice more, I only had like 3 left. So what I did is I went back and I would cover my answers that I chose previously, and I would just read the scenario and then pick which ones that I thought, and I would recount my points at the end. And of course, I did so much better than when we just did it in the Kettering seminar because we all didn't really study yet. So yeah. What really helped me was using the Lindsay Jones website online. Lindsay Jones, just the format of everything is just so like the ClinSims that I really liked it. The Kettering Seminar website does have practice simulation problems for you to do, but they only have 2 simulations that are free, and then they have a full 22 simulation that you can take only twice. And then the rest you have to buy tokens and use the tokens to take more practice tests. So what I did was I did the 2 free ones before I started studying just to see how I did. They were COPD, so it was pretty easy. And then I did the full 22 simulation practice. I did the whole thing just to see where I was at. And you can only do this twice. So I did one after not really studying a lot, and I wanted to see where I was at and see my weak points. And once you finish it, you can click each simulation and review what was wrong about it, what you did well about it. And that's a really important piece of studying for the ClinSims, is you want to go back and you want to review why that answer is wrong, so you know not to choose it again. And you want to review why this answer is right, so you know to choose it. So the ClinSims really is just all about practice, practice, practice. And it's just test-taking skills and learning what to pick and what not to pick. So after I started studying with my lecture notes and writing my own notes and everything, then I went back maybe like a week or 2 later and I did the 22 simulation again. And this time my score was improved, obviously because I've been studying a lot. And after that I just felt good, you know, I felt like, okay, my score is improved. I've read the book twice, I've written my own notes, I've taken like hundreds of Lindsay Jones simulation practice exams. There's nothing else I can do at this point besides take the test and hope that I pass. So yeah, I definitely, after doing the Kettering practice test, I stuck with Lindsay Jones, and I just did Lindsay Jones over and over and over and over. And the best part about Lindsay Jones is that they have a teaching mode. So you can take the test in teaching mode, and every time you choose the answer, right when you choose it, it's going to tell you if it's right and if it's wrong and why you should choose it. After taking those tests, you know, I probably did at least each simulation at least twice. Once you get to the 3rd time or more, you're gonna start memorizing the answers. So what I would do is, like, if I did asthma and I did kind of bad and I wanted to redo it, I would do like IRDS, and then I would do pulmonary embolism, and then I would go back to asthma later. And usually they have 2 asthmas that you can do, so I would do like the other asthma, or if it was the same one, I took all these other tests that I don't even remember all of my answers that I was choosing before. But eventually you are going to start memorizing. And it's kind of a good thing in the sense that every time you see this answer, you know it's for asthma. So every time you have an asthma patient and you're going down the list and you're like, I don't know what it is, you can be like, oh, I remember I saw that on my practice test. And so you're going to choose it. So you definitely have to study and you definitely have to know your stuff. But a lot of the ClinSims is kind of memorization. It's remembering how to treat that patient. And obviously when you're learning, that's what having knowledge is just kind of remembering something. So I don't want to say it's a memorization game, but at the same time it kind of is, if that makes sense. Something else I took notes on, which I feel like was really important for me, is I was starting to realize that I was having trouble with memorizing certain medications. So what I did is I just created a page of medications, and even if it was something that I knew, I would just write down all the medications that I thought that I would see on the ClinSims, or that I did see on the simulation practice exams. And I would just write down what it is and why would you use it. And that just helped with, you know, remembering little things, and like if there's a PVC, you know to give lidocaine, you know, so I would just like write that stuff, so whenever I saw it, I just knew because I wrote it. You know, if there's a CHF, pulmonary edema patient, you're going to give Lasix. And eventually you just learn it and remember it, and when you see it, you're gonna know what to choose, you know? And something else I wrote down was just normal values, because they are gonna hit you with like little things like end tidal CO2s or like vital capacities. So you kind of have to know normal ranges for those things, but you should also kind of already know those things. For those of you who don't know, the ClinSims is 22 simulations, but they only score you out of 20. So 2 of those simulations you can do completely bad on, and they're not even going to count towards your grade. The only problem is that you don't know which 2 are not going to count towards your grade. So if you're getting a super hard one, you could probably assume that that's the hard one that's not going to count towards you, but you also have no idea. So you definitely are going to have 22 simulations, but some of those simulations are going to have the same thing. So what I saw on my ClinSims was I would have like 3 or 4 COPD, I would have like 2 or 3 asthma patients, I definitely had at least 2 IRDS patients, I had a malnourished male come in, he was 5'10", but he was underweight, and he had like needle markings. So you want to do your HIV test, and you should know what the Pseudomonas of the HIV is, because they're going to show that, and from that sputum culture you should know that that is HIV, and you should know what med to treat HIV, which is going to be the Nebupent. And so there's things like that where a patient's going to come in and you're thinking, oh, they just have like pneumonia, or oh, they're just sick, or they're homeless, but no, it's they have pneumonia and they have HIV, you know? So it's, in terms of trying to diagnose the patients, a lot of times they tell you what it is. So I think that that was something that I was worried about, is like, how am I supposed to know to diagnose every single patient? But a lot of the times, most of the time, I think they actually tell you what it is. Like, they say a 60-year-old comes in with a 20-pack year smoking history, so you're automatically COPD. Or a patient comes in and their parents are smokers and they are having wheezing, so you're like, oh, it's a peds asthma, you know? A lot of the things that they do tell you what it is, so it's not too difficult. You know, they're gonna say a patient comes in with a motor vehicle accident and the car caught on fire and they were inside the garage, so you automatically know that's a smoke inhalation issue, you know? Yeah, so back to the Sims that I saw on my exam. I had at least 3 to 4 COPD, I had 2 adult asthma patients, and I believe 2 peds asthma patients. I had 2 to 4 IRDS patients, so make sure you know your IRDS. I had a motor vehicle accident patient with a neck injury. I had an HIV patient, and what else? Oh, I had a chest trauma patient with broken ribs, and they are also going to throw at you some EKG strips, like what is this rhythm, what would you do, you know, asystole, do compressions, or an MI, or a PVC, give lidocaine, you know, stuff like that. So you do have to go over your heart rhythms, but I wouldn't necessarily stress over ACLS, but I did definitely have like 3 or 4 heart rhythm strips. Something about the ClinSim simulations is a lot of them are short. So when you're practicing your simulations, you're getting a long simulation that's going to take you like at least 5 minutes. But when you're actually taking your sim, sometimes it'll say a patient presents with this, do an initial assessment. You do your assessment, and then it says, now what would you do? And then you say like, give oxygen, and then it says, the physician asks, what test would you run? And then you say like ABG, chest x-ray, and then it says end of simulation. And you're like, what? Like, you don't even get to see the patient go on the vent, you don't even get to see their ABG on the vent, you don't get to see if they do better. I had at least like 4 where they just like ended after like 3 questions. So you're not sitting there doing like crazy long ones, but then some of them are super long. Some of them, you have a patient who comes in, this and that, you get their diagnosis, you put them on the vent, you do the ABG, you take them off the vent, and then the heart rhythm shows this. What are you gonna do? So some of them can be quite long. But I think the biggest thing is to just breathe, to relax, to really read, is it saying it's a quick assessment? If it's a quick assessment, you don't want to be doing chest x-ray and ABG because that takes time. So you just want to do like your vitals and whatnot. If it says select as many, then you want to select as many. And yeah, it's just really important to read. Breathe. If you do really bad on one problem, once you're done with that simulation, don't carry that negativity into the next one. Just, refresh yourself. And if you need to take a break halfway through, something that I did was I tried not to look at what simulation I was on. If it said end of simulation, I wouldn't read like simulation 4 of 22 because I just didn't want that. So I just click end of simulation and then go to the next one and not even look. But definitely by simulation like 19, you start getting really antsy because you're like, I only have 4 more. And by that time you're like mentally fatigued and you're like, oh my God, I'm about to find out if I pass or not. So just try and like stay in the zone towards the end because you are almost done and you don't want to mess up at the end. But like I was saying earlier, you definitely want to focus on your information gathering. So for almost every single patient, you're going to be doing the same thing. You're going to be doing your sensorium, you're going to be doing your vitals, you're going to be doing your medical history, your SpO2, your respiratory pattern, you are going to be doing the color. You really just want to do your visuals, you want to look at your patient. Those are your quick initial assessments. Then if it gives you another assessment page, then you would do like your chest x-ray, your ABG, your slow vital capacity if you need to, that's where you do all your other longer ones. And then when it comes to your ventilator settings, make sure that you're reading what is wrong with your patient. If you had them on 40% Venturi mask and their SpO2 is like 80 and on your vent settings, then you probably should go up on your FiO2 and make sure that there's some PEEP in there. Or if they were on 40% and they're doing fine, then you want to keep them on 40% on the vent. And definitely do process of elimination, so you're not going to pick the tidal volume that's 700 and you're not going to pick the tidal volume that's 300 for the 6'2" guy, so there's definitely ways to weed out some answers in there, and don't be picking medications that you've never heard of. Something that I always picked was serum electrolytes. And I found out that in my practice simulations, electrolytes is always a positive benefit and it always gives you like 1 extra point. So why not pick it, Yeah, just, read and study. And I know it's kind of hard and there's not a lot of things to do in terms of studying for this, but it's all about your test taking skills and yeah, just kind of knowing what to pick when you see it. So that's why you definitely just have to practice. I don't think there's like a secret way to pass the ClinSims. I don't think there's some grand thing out there that's helping people pass. It's all just kind of about studying, and I know that's maybe not what you want to hear, but that really is just what it is. Some advice for your IRDS patients, your premature infants. You always want to kind of go in this pattern if it's presented and if those options are available. You always want to manually ventilate the infant first, and then you want to switch to oxyhood 40%, and then you want to go to nasal CPAP, and then intubate if necessary. So a lot of the times, what I found where I struggled, and my friends and people who have messaged me on Instagram, is that you're kind of going straight to nasal CPAP because we know that nasal CPAP is just good for the infants and most of them are on it and it's helpful, but they really want you to do the first step first. So you're going to bag them, and then you're going to go to the oxyhood, and then you're going to go to the nasal CPAP. And in my head I was thinking like, oh, that's just wasting time, let's just save the baby, you know. But the ClinSims is all about doing a step-by-step process, so make sure you're not jumping ahead. But yeah, so I hope you guys found this video just a little bit helpful. There may have been some things that I forgot, but it's definitely about practicing these simulations. I highly recommend Lindsay Jones. It was so helpful for me. The teaching mode, like I said, you can see what's right and what is wrong. Definitely take your own notes. If you have Kettering, go through these books and figure it out. And if you have any questions, message me on Instagram at GARRYRT, GaryRT. And follow me, subscribe, like, comment, and yeah, bye.